Food fortification is not a new idea in India. As early as 1953, the country made fortification of hydrogenated oil mandatory. Since then, it had been going on. India is one of the global leaders in using fortification as a part of the strategy to address micronutrient deficiencies.
We have a basket of solutions that are implemented to address the problem of malnutrition and specifically anemia. The basket of solutions include dietary diversification, supplementation, social protection, behavioral change and fortification.
So food fortification really has to be working with what the people are consuming primarily. Unless and until you target all those who consume wheat with large-scale wheat fortification, the overall prevalence of anemia and iron deficiency will not come down. Anemia itself is not driven just by iron, deficiency of iron. Anemia is driven through a multifactorial etiology. So unless you look at it in its entirety and try and give multiple nutrients using multiple vehicles, I wouldn't think that anemia will go away so easily.
Three things are important. One is integration. That is, we must integrate food fortification activities into the other interventions that are going on. The second one is evidence. It should move away from just as an activity to an activity towards achieving impact. And third, I think most important is about equity. We should ensure that the food fortification programs really reach the most vulnerable.
Food fortification is one of the most cost-effective and scalable solutions that could help in addressing anemia and micronutrient deficiencies. Food fortification is more of a preventive strategy. It works well along with other strategies. So you do need the other strategies, but food fortification needs to be a part of whatever strategies governments are implementing towards addressing anemia and micronutrient deficiencies.
It's absolutely essential to integrate food fortification with public health programs. Now we are focusing on wheat fortification to increase the iron content and the folic acid content. I see there is a great potential for it to be absorbed and made a part of the policy initiative of the country. It requires a political will to scale up a thing. All other stakeholders have to get together and make it a movement. Only then will people respond to this fortification call.
You know, we have more than 2,000 flour mills in India, and many of the flour mills are already doing what is very, very important to create a demand. It is suggested that Government of India consider distribution of fortified flour in place of wheat in their PDS system or any welfare program that will generate a demand for the flour mill.
It's actually an advantage that in wheat flour there is no mandatory fortification, because in case of a mandatory fortification you can't distinguish your product from the other because you are doing fortification. This is a blue ocean, and this blue ocean where you can kind of create your own brand on the basis of claim of fortification and in such a hugely competitive market with very low margin. So this could be a big differentiating factor.
So for any strategy, including food fortification, we must adopt the approach of whole of society and whole of government. There has to be a synergy of science, policy, data, evidence generation and industry and innovations which come together for a sustainable impact.
Basically, there is not an issue for doing a large-scale fortification. Only thing is, the government and the industry both have to take it up together. We've done a lot of volumes in the country, so no complaints regarding color or anything to do with the nutritional capacity.
We are having a very good fortification program in India, and the government has invested so much than any other country. We have made our own standards and we have made it at par with what we need to do by looking at the WHO guidelines, the codex. So we need to just scale up all that and bring it so that we can, if we strengthen our quality control, that's one thing which we need to do, and then the program will be really successful.